Well, it's no secret that New Hampshire has been hit hard by the opioid epidemic. New Hampshire State epidemiologist Dr. Ben Chan joins us to talk about some of the infectious disease complications that come with injection drug use. Good afternoon, Dr. Chan.
Good afternoon.
Well, let's dive right on in. What are some of the infectious complications that someone who injects drugs like heroin could face?
Yeah, so there are a number of different infections we worry about in somebody who injects drugs. Some of these are familiar. HIV. HIV is a virus that can chronically infect and destroy a body's immune cells, leading long-term to an acquired immune deficiency syndrome. We've seen large outbreaks of HIV in persons who inject drugs in Indiana back in 2014 and 2015. These populations have also been found to have very high rates of hepatitis C infection. Hepatitis C is a virus that can chronically infect the liver, lead to long-term complications of liver cirrhosis and even liver cancer. And then there's a whole host of serious bacterial infections that can be introduced into a person's body when they non-sterilely inject drugs into a blood vessel or a vein. This includes serious bloodstream infections, heart or heart valve infections, even bone and spine infections, which can require extensive surgery and weeks, if not months, of antibiotics and can be fatal.
Is this a big problem here in New Hampshire?
Yeah, so New Hampshire has a relatively low number of new HIV cases diagnosed every year, on the order of 30 to 40. New Hampshire has not seen an outbreak, but what we have seen is that beginning in around 2017, the percentage of individuals with newly diagnosed HIV that report injection drug use as a risk factor has begun to increase. That's about 1 in 4. We've also, hepatitis C has become reportable in New Hampshire over the last year and a half, and as we've taken new reports of hepatitis C infections, about 85% of those report a history of injection drug use. The bacterial complications are more difficult to get a handle on, but what we're hearing from hospitals and healthcare providers is that there's a large burden of these types of infections in hospitals that's straining the healthcare system.
So what is the public health services? What are they doing to stop the spread of these infections?
Yeah, so this is obviously a complicated issue, and one of the primary things that's needed is to treat the underlying substance use disorder and mental health needs of a patient. This is something that the department as a whole is very committed to. Regarding some of the infectious disease complications, it's really important that all healthcare providers ask their patients about risk factors like injection drug use, substance use disorders, and screen their patients, test them for HIV and hepatitis C. We would encourage patients and family members of patients who inject drugs, if they're not offered testing, to seek out testing. And then we're working very closely with our 2 local health departments, Manchester and Nashua, to try and support services in those communities that have been hard hit by the opioid epidemic, and to try and increase testing in those communities to identify people that may have some of these infections that have not come to the healthcare system yet.
So much information, so little time. Dr. Chan, thank you so much for your expertise. We really do appreciate it.
My pleasure. Thank you.